Chitra, can you hear me?
Yes, ma'am. Yes, ma'am. Perfect, ma'am. We will start in a minute,
Hello?
ma'am. Ma'am, can you hear me, ma'am?
Hello?
Ma'am, can you hear me, ma'am?
Yes, Chitra, you are audible.
Ma'am can't hear us, I guess.
Oh,
Ma'am, can you hear me?
Can you hear me?
We can hear you, ma'am.
You can hear me?
Yes, ma'am.
Okay.
okay. So we are starting. So good evening, doctors and all the participants. I, Dr. Suman from Shield on behalf of Shield Healthcare, welcoming you all in today's webinar conducted by Indian Fertility Society, and the topic is very interesting: developing researching skills. It is from IFS Tamil Nadu. So now it's time to start by brief introduction to the coordinator. Chitra, can you please share?
Sanjay Varsalapa.
Can you change the slide? Yes. So it's my immense pleasure to introduce Madam Dr. Indumati Joy ma'am. Madam is DGU, DNB and Senior Consultant in IVF and Gynec Endoscopy in Nova IVF Fertility, Anna Nagar and Abadavalani, Chennai. Madam has experience of more than 25 years in the field of reproductive medicine, OBGYN, and 15 years in the field of reproductive medicine. She's the executive committee member of IFS Tamil Nadu chapter, member of ASRM, ESHRE, POXI, ISAR, TAPISAR, IAG, PCOS societies, and many other societies. And in terms of academic activities,
hear you.
in terms of academic activities, Madam is as a guest invited faculty to conduct many fellowship exams, academic webinars, and presentations in national conferences. And has authored and co-authored several books, papers, and journals.
Just 1 minute.
Sorry, am I audible, Chitra Kumar?
Yes, Suman, you're audible.
So in area of interest, minimum stimulation protocol in IVF and gynec endoscopy is the key area of interest in them. So with the short introduction of Dr. Indumati ma'am, I request to hand over the session to ma'am for further proceedings. Thank you very much, and over to you ma'am for further proceedings.
Thank you, sir, for the kind introduction. I would like to invite the chairperson for the afternoon session, Dr. Radha Vembu ma'am. Dr. Rajpriya, unfortunately, is not able to this. So, Dr. Radha, Madam is currently the professor and HOD of Sri Ramachandra Institute of Higher Education and Research. She is a diploma in obstetrics and gynecology in Mysore Medical College and also DNB at St. Martha's Hospital. She was also she was working as a consultant in Rotary Muthappa Memorial Hospital. And ma'am now is the current professor and HOD. Over to you, ma'am. I request you to introduce the next speaker, ma'am.
Good afternoon, everyone. Am I audible?
Yes, ma'am.
Yeah.
Yes, ma'am.
Good afternoon, everyone, for this very interesting session on developing the research skills. This is one of the very important topic of the day, and which is very useful for our postgraduates and also for the researchers. Without wasting much time, I would like to introduce the first faculty, that is Dr. Siddhartha. He is first MCH of the country, and he worked formerly as an associate professor in the Department of Reproductive Medicine and Surgery at Sri Ramachandra Medical College. And he has currently, he is a consultant and director in his own place. He is also secretary of Andhra Pradesh chapter of IFS, and he has many of the publications, and he has been a faculty in many of the national and international conferences. Today, he is going to talk and something about how to critically appraise an article, which is very, very important for the postgraduate and also a clinician, whether to rely on these articles which are published in various publications, and how do we take the results That is very, very important. So I request Dr. Siddhartha to start this session.
The article is presented by Dr. K. Kanagalakshmi. Kanagalakshmi is a fellow in reproductive medicine in Aishwarya Fertility Center. And she was also an assistant professor for 4 years in Thiruvarur Medical College and also a consultant in KG Hospital, Coimbatore. Now she is here in Chennai doing the fellowship. Over to you, Dr. Kanagalakshmi. Please present your article.
Yes. Thank you, ma'am. Thank you for introducing me. Ma'am, is it seen, ma'am? No.
Oh, you need to share your slides.
Not
Yeah, we can see your slides.
Okay. Can I start, ma'am?
Yeah, yeah.
Good evening, ma'am. Good evening, ma'am and sir. And I'm very much happy to present in front of you all. And I especially thank the IFS team, Dr. Indumathi ma'am and Dr. Rajapriya ma'am for giving me this opportunity. So the article given for me for critical appraisal is the endometrial receptivity array before frozen embryo transfer cycles, a systematic review and meta-analysis that was published in Fertility and Sterility Journal in Feb 2023. And to start with, implantation, as everybody knows, is the rate-limiting step for IVF cycles. Despite euploid blastocyst implantation, failure occurs in approximately 32 to 51% of all embryo transfers. And the prevalence of recurrent implantation failure is said to be around 10 to 20%. And hence, the area of intense research being the endometrial receptivity as a potential therapeutic target has come over, and it has led to the ERA test. So ERA identifies the displaced window of implantation, and it also proposes an optimal transfer time, which is known as the personalized embryo transfer. However, there remains a conflicting data in terms of the applicability of this personalized embryo transfer. Importantly, its impacts on the clinical outcomes as well. So the main objective of this systematic review and meta-analysis was to investigate the impact of endometrial receptivity array before frozen embryo transfer in patients undergoing IVF, and also to examine the clinical utility of adding the ERA testing in FET treatment cycles to improve pregnancy and live birth rates in patients with or without recurrent implantation failure. So this study was conducted according to the preferred reporting items for systematic reviews and meta-analysis checklist. The study protocol was also registered in the Prospero International Registry. So all these steps which are essential in the methodology was followed in this study. The systematic literature search was performed by 2 independent investigators, and it was started from its inception to February 15, 2022. And the database search used clinical keywords like endometrial receptivity array analysis, IVF FIXI, and then references of all the reviewed articles were manually reviewed, and the eligible studies were added to the electronic search system. So the included studies were randomized control trials, retrospective and the prospective comparative study that were done between ERA and non-ERA tested population. And the included studies had at least one of the following domains which were observed in the outcome measures. And the exclusion criteria included all the abstracts, any editorials, letters to the editors, and all the animal experimental studies were excluded. And the outcome measured, the primary outcome was the ongoing pregnancy rate and the live birth rate, whereas the secondary outcome was the implantation rate, miscarriage rate, clinical pregnancy rate, and biochemical pregnancy rate. The extracted data was documented in a standardized sheet. And then if at all there was any disagreement from the 2 independent investigators that was for the intensive search, a 3rd investigator was appointed and the disagreement between them was resolved. In this paper, they haven't mentioned any disagreement or any issues that have been resolved as well. And then the quality assessment was done between the randomized control trial and the non-randomized control studies. So the randomized control trial quality assessment check was done using Cochrane risk of bias tool 2. And for us, the other studies, the retrospective and the prospective studies, it was using Newcastle-Ottawa scale, which is a study to assess the non-randomized trials. And they have given the scores of
slides are not moving. I'm not able to see the slides moving. Is it the same for everybody?
Yeah, sir. I'm just explaining the points alone.
Okay.
Yes, sir. And then for the statistical analysis, they have used the Revman version and the Stata V14, which is a standardized one. And they have also analyzed if at all there were any confounders or if at all there were any adjustments made, odds ratio, and also using separate analysis between the randomized and the observed study groups like retrospective and prospective. And as well as subgroup analysis was done, especially for the recurrent implantation failure population among the studies, which for which the included criteria had the recurrent implantation failure. And the tests of heterogeneity was also done using I-square and as well as the p-test for all the studies and also for the subgroup analysis. So finally, with the extensive searching, 296 articles were identified, and among them, 142 were only selected. Others where duplicates have been removed, and nearly 142 were finalized. And with the eligibility criteria of having the included studies and as well as the outcome measured, 67 were selected. And among them, with the inclusion criteria being for all the 8 studies were alone separated. And the reasons for exclusion has also been mentioned for the eligible studies. So the 8 studies that were included for the meta-analysis were from different regions. And one study was the multicentric randomized control trial. 5 of the studies were retrospective, and 1 was prospective, and 1 other was not recorded as which study design. And all the selected population had the outcome measured, like either the primary outcome or the secondary outcome. And the confounding factors has been adjusted only for 4 studies. For the other 4 studies, it has not been adjusted. And for analyzing the quality, nearly all the studies that have been taken were more than 7 score, being a high quality for the bias tested. And for the randomized control trial, the Cochrane risk of bias tool 2 has identified some concerns, and that concerns for mainly for the inconsistencies for the trial registration, and as well as the invalid cumulative analysis among the tested people in that. So a total of 2,784 sample size was analyzed from the 8 studies, and the ERA tested group was 831 and the non-ERA tested group was 1,953. And then among the 8 studies, only 3 studies had the inclusion criteria of recurrent implantation failure. That is the Basil study conducted, Basil et al. Study conducted at Canada, and Jaya et al. At China, and then the Ohara et al. At Japan. So analyzing the results, so the meta-analysis of ERA testing versus non-ERA testing, the primary outcome was analyzed from the 5 studies. And in the 5 studies, Ohara et al., as a study conducted at Japan, seemed to be favoring the result of having a higher ongoing pregnancy rate and live birth rate. Whereas the overall pooled effect shows that the diamond falls under the line of null effect. So there was no significant difference between the ERA and non-ERA tested population for the primary outcome. And this analysis was also tested for heterogeneity, and the I-square seemed to be more than 50%. So it is very less for being homogeneous. And for the secondary outcomes that were measured, the studies were grouped for clinical pregnancy rate, biochemical pregnancy rate, implantation rate, and miscarriage rate. So this is the forest plot for each outcome that is measured, secondary outcome that is measured. So similarly, the meta-analysis, the forest plot that have been identifying the clinical pregnancy rate shows that the diamond falls under the line of null effect, so it is non-significant. Yet the Ohara et al., the study conducted at Japan, shows that it is favoring the higher clinical pregnancy rate, that is the population tested for ERA, but yet the overall significance doesn't correlate, and it is for non-significant for the clinical pregnancy rate. And as well as it is like for the other outcomes like biochemical pregnancy rate, implantation rate, miscarriage rate, everything shows that it is non-significant between the ERA and the non-ERA tested population. So, and for the heterogeneity of the study also, most of the studies seem to be heterogeneous, being the I-square falling more than 50%. And yet the pooled odds ratio for sensitivity analysis, it has also been done. In that also, the odds ratio identify that there is no significant difference for the primary as well as the secondary outcome that has been measured with or without the adjustment of the estimates, that's the confounders, has also been analyzed. So the subgroup analysis mainly performed for ERA testing for recurrent implantation failure. The 3 studies, as I told you, mentioned earlier, has been analyzed. Though one study, the Ohara et al., favors the use of ERA testing in recurrent implantation failure, yet the overall effect seems to be non-significant when controlling for the confounders. So finally, for discussion, so the impact of ERA testing before embryo transfer, the ongoing pregnancy rate and live birth rates were not statistically different. And the subgroup analysis of cases with previous recurrent implantation failure also did not show any significant difference in primary as well as the secondary outcomes. And the multicentric randomized controlled trial on the performance of personalized embryo transfer, actually that study was the only study which has been identified among the meta-analysis for the purpose of intention to treat analysis group, because rest all were the retrospective and the prospective study. So yet there was no reported benefits in using ERA testing in groups in recurrent implantation failure as well as in the general IVF groups. So then determining the optimal endometrial receptivity time by ERA, so does not seem to improve the overall effect. And then the hypothesize, and one more fact of that, the hypothesize that local endometrial injury because of performing this ERA testing added a beneficial effect for the groups, but yet there are certain meta-analysis that has shown that there is no any beneficial effect of this, and it needs further more robust studies. So using the ERA as an add-on to fertility care without proven evidence of its clinical value or utility increases the financial burden of fertility care, requires additional time, intervention, and resources to prepare for, and also additional invasive procedure that may cause discomfort for the patient, and it can be associated with a small risk of intrauterine injury or bleeding or infection. So we need robust studies in order to conclude, to have a beneficial effect of this ERA testing. So well-designed RCTs using ERA data for cases with RAF might help clarify this issue of having a role of endometrial receptivity on embryo implantation. And further evolution of both embryo and endometrial genetics will throw more input in this, and a better understanding of the physiologic, immunologic, and molecular mechanisms definitely needs to improve the outcomes of the ART techniques. So the strength of the study, it is the first systematic review and meta-analysis that has been done. And the limitation is that most were retrospective and only one was a randomized and 2 were clinical trial. The heterogeneity of ERA kits and the testing modalities were different, and the preparations were different, and biopsy procedures, timings were all different. And they were not able to control for the causes of implantation failure. So the wide confidence interval and each of the study suggests that it is an imprecise result. And the Newcastle-Ottawa scale is like, it can even rate a critically flawed study as being good quality. So finally, to conclude, according to the findings of this current meta-analysis, it is not clear whether ERA results in an increase or decrease in pregnancy rate among patients undergoing IVF-ET cycles. And this add-on procedure should be integrated into routine clinical practice only if it is proven to have clear evidence of efficacy, utility, and justifiable cost effectiveness. Thank you. Thank you for giving me this opportunity.
Yeah, basically this analysis is very the first of its kind, what you have said. And it has taken retrospective studies because those are the studies that are available, because our cities are difficult in this to conduct in because to conduct an RCT is not very easy, and it requires a lot of clearances, a lot of regulatory compliances have to be sought, and the patients have to be insured if it's an intervention, and the funds, the raising the funds for this is difficult. So yeah, the heterogeneity is very high, which what all the studies have quoted is almost in 80s, it's coming 80s, I agree. And you've also mentioned the factors for heterogeneity. But some studies have controlled for the factors, and they have so that to some extent this could have been utilized. I don't say it doesn't exist, but when you control for all the other factors, maybe the effect of this to some extent may be reduced. And yeah, of course, they have used new Ottawa scale for to identify the risk of the bias, and this can, yeah, that's the problem with it. But at least like every study, it won't rate in a good way. At least when it some, because all the studies are rating more than 7.
Yes.
So it means that they have done the best to select these studies, and out of 265, 165 something, only 7 they have come out. Means that they have screened the studies very effectively and all that. But it is reasonable to believe that in none of the studies the odds were significant enough. Apart from O'Hara et al. 2022, none of the studies the odds were really significant. So maybe that what they have said, there are many other factors which would have caused. They have not controlled for the euploidy of the embryos. If you have read the study carefully, the euploidy rate of the embryos was not controlled in these studies. So, and we don't know how many embryos are euploid, and we don't know. PGT can't even answer that because mosaicism is again a significant factor. We can't keep on testing the embryos. The new ART guideline also doesn't allow us to test routinely unless it's indicated. So maybe that the implantation potential of the embryo and endometrium will change. It will not be constant. So what transcriptomics you see this month may not reflect, is not going to at least be stable. That's the hypothesis which we believe, that once we do the transcriptomics this month and next month also it should be the same. That may not be really true. So, and the other factors like local endometrial injury, all that really could have contributed. And not all the factor, not all, and they have different definitions of the recombinant implantation failure and different indications for doing an ERA.
Yes.
So these are a lot of, that's where the heterogeneity is coming wider.
Yes.
But at the end, but I think maybe at least I think, I don't know, I should know because you have gone through this extensively and read. Maybe this has got even there was one more meta-analysis, not meta-analysis, there's one more study critiquing ERA in New England Journal of Medicine recently. And so, do you think that definitely there is some evidence to point that the implantation may not, because the implantation window is wider. It is not a timed event. It doesn't critically occur at that hour and that minute. So maybe what I want to ask is, do you think that there is some reason to believe that these statements to an extent possible and use it with a lot of caution in the day-to-day clinical practice?
Yeah, sir. If at all, definitely like controlling the indication for ERA testing, I think this definitely will work out, sir. Like if at all we have an euploid embryo status, like at least morphologically good quality embryos that we have taken, and in a population where other factors for failure of implantation being, even if at all, like endometriosis, even if it is PID, which can affects the implantation, and also if tested for any immunological causes also, even after ruling out that, if we do the ERA testing and if it seems to be positive, receptive, then definitely it would be a very good opportunity for us to do that.
Because it's only one of the factors. It is
yes.
not the factor for recurrent implantation, but it's only the one of the factors.
One of the factors. Yes.
So all the other factors are not properly controlled. That's the major problem.
Yes. Yes.
So that is the thing. Maybe other
But
people
even
like-
if with other factors, can we do it's a really no possible idea for me, sir.
But there are a lot of things about the endometrial immunology of the endometrium. There are a lot of things coming about natural killer cells, and even there are a lot of things about the pinopods. And see, implantation is a very complex event, and it doesn't occur at one point in time, because even practically, forgetting the evidence aside, practically we have seen patients with one additional dose of progesterone. Maybe you thought that you want to transfer day 5 blast, which has not grown, and you thought day 4 or day 3 embryo and transfer on the same day, because the embryo has arrested the previous day 3, which you have kept culture for day 5, didn't do well. They have done well actually. So implantation is is very wide. But we can't say that by that these studies are doesn't support. We can't say by our own clinical experiences, which is even less than level 4 evidence. But there is a reason to believe, even in the practical sense, that the window of implantation by transcriptomics alone may not be the only factor causing implantation failure. And if you control for all the other factors, and you have only the with good quality embryos, euploid embryos, with all other factors excluded, you have only the receptivity as the point of analysis. Such a kind of RCT is very difficult to perform, though. Maybe ideal to look into that. But even these studies can reasonably tell us that we need to be careful with this modality of evaluation as a routine for all patients of recurrent implantation failure.
Yes, sir. Yes, sir. Yes, sir. Sure, sir.
Maybe Dr. Radha and other senior people are there. They can tell their valid inputs.
Ma'am, do you normally advocate this method in RIF patients, ma'am? Dr. Radha, ma'am.
Not routinely as such, as he is already saying, it is not being done routinely as such.
What is your case selection process? I mean, whom would you? We know that we are not testing for aneuploidy, or the indication is no more there. But in the present scenario, I feel very difficult to advise this ERA even after 2 implantation failures, because we don't know how much it is going to help. Because as Siddharth told, the implantation window is quite wide, where you cannot study everything. You know what the pinopods are doing or what they are doing every day, we can't study. We only go by the progesterone value and the day of progesterone start. So I'm not sure for how many at present, assuming that the embryos will be good, for how many we can advise this, I don't know, ma'am.
As he said, what are the commonest causes which can be ruled out? If that is being done and we have good quality embryos, then probably we should think of this. This is not the modality of choice as a first investigation. So we routinely don't do this until and unless patient has got 2 or 3 failures and with good quality embryos, all the other common causes have been ruled out, then probably we go for this. Because it may not help much in majority of the patients. Maybe only for a small fragment of patients it may be of use. Maybe selectively if we are choosing it, then probably yes. But it cannot be a first modality of choice, as he has said already.
Regarding the heterogeneity, you were saying like I-square is high, but for a certain level of heterogeneity, they also say the number of observations to be taken to increase the stability of your analysis. if I-square is around 80, that's the studies where I found a long time ago. Maybe if it's 80%, what I can remember is around 7 to 8 studies have to be taken, and some 300 to 400 observations have to be done. So even with the I-square value, that will guide us how many studies have to be included to make your analysis more stable, and how many observations have to be included. That also is there. Maybe Dr. Pankaj sir and somebody are there, if they can tell us more about it. Radha madam.
Yeah, what you're saying is correct only. Now, with the latest literature which is coming of late, they are saying that it may not have much value. Okay, so we should take into consideration as many of our, in an institution-based practice, we think twice before we implement anything new. Immediately, we should not jump. That is what we follow it. We do utilize it when there is an indication, or not for all the patients. And then after seeing the data and analysis, probably if we start implementing it, it might be useful. Initially, way back, if we take a couple of years back, for everyone, we were doing this procedure as a routine, rather in the sense more commonly. But once we know the evidence, what is coming out of that, probably we will have to change, and we have to be updated with our scientific knowledge. And probably in an indicated patients, yes, it may have a role, but it may not be a day-to-day routine practice. Any other faculty wants to add on? Any comments on this? Okay, and I just wanted one more input from Dr. Siddharth, not pertaining to this article per se. When we are critically appraising an article, what are the salient factors you look for in that? Say, for example, the sample size, the design of the study, how it is, the methodology, like that. You want to add any important certain salient points so that it will be useful for the other fellows or the residents for critically appraising an article, because each article cannot be taken directly. We have to analyze that article before we accept it. So what is your take on that?
Mostly when we're critically appraising, one is what is the objective, and whether to attain that objective, what is the type of the study chosen. For a diagnostic test, somebody can't choose a cohort study. Usually it should be a case control study. So it depends on what is the objective and what is the type of, so with that only there can be a methodological flaw identified. So there are certain, for certain objectives, only certain types of study designs only are useful. And for certain objectives, only RCTs, for drug trials, RCTs have to be utilized. That is a study design. So that is first thing. And the other thing is the sample size. So whether for any prospective study, if it has been done in a proper methodological manner, so what is the sample size estimation, how they have achieved the sample size have to be taken into consideration. If that is not explained, then mostly there is some kind of ambiguity. And or we need to know from the evidence available prior to the study whether samples of that much is going to test the desired effect that we by experience and in the field, maybe if you and by our own practical experiences before, and if you have done studies for ourselves, we will know really whether that, suppose if you have a study on a DNA fragmentation index, because I did my postgraduate thesis on that. So you should know whether really people have, when going through previous studies, whether the samples, some samples has come with 50, 100. So whether really they sufficient to give a cutoff of the effect. So that is more important. Any prospective studies, there should be a proper justification of sample size. And the methodology is very, very important, like how the study is done. And if it's a diagnostic test, what is the kit used? and whether is there any and if the diagnostic system, is there any gold standard, and whether a gold standard is compared. So we can't take something else for substituting the gold standard. Suppose if PCR is a gold standard for a diagnostic test, you can't substitute ELISA and compare with the new test. So whether a gold standard is utilized properly, and how the selection criteria was designed. So the selection criteria should be designed to in such a way that the risk of bias and other methodological flaws should be kept minimized. So it should not be very generalized. The criteria should be very focused so that the methodological flaws and risk of bias should be minimized. So the selection criteria, and then after going through all that, what are the exclusion criteria? That's very, very important, because having included patients, there are some patients, if you don't exclude, the results can be flawed. Like if you are doing any study on recurrent implantation failure, patients who have been operated for multiple fibroids and severe intra-aortic issues, they tend to have thin endometrium. They don't have poor endometrial vascularity. So some other factors which can affect implantation have to be safely excluded so that there can't be any effect modification because of that. So, and then how the results are analyzed. So by looking at till this point, mostly we'll know the reliability of the study. So if till this point, if there are a lot of flaws, there is no point in seeing the results, because you know that obviously they're going to get modified. So then comes results, and whether the appropriate statistical tests are applied. The other most important thing in the results is we normally tend to use chi-square tests, we use student teachers, but whether to do that comparative analysis, whether there is any better test compared to depending on the number which we're analyzing, number which we're comparing, whether we have to use a chi-square or a t-test, or whether it's a numerical data or a qualitative data, and which is the most appropriate test. Parametric test should be, or non-parametric test should be used. So it should be done with a proper statistical consultation. Some people just do with a SPSS knowledge and some Google and just apply the test.
Statistical analysis should be there. That is
so. And not only interpretation of the p-value, but what is the real significance of that p-value compared to other studies have to be carefully analyzed in the discussion. Discussion, not just putting 3-4 studies and just writing your study data, but whether your study results are comparable to other studies, and if not so, what was the problem? Whether there was a problem with the type of the sample size, whether there is a problem with the type of inclusion criteria, we should be able to substantiate reasonably in the discussion, and only after all these things, with a proper methodological design and with a proper analysis, only then the conclusions can be taken as credible in that step.
Okay. The salient points he has already addressed, that when you are appraising an article, probably you should see mainly the objective, what is the sample size, their selection criteria, then how the methodology has been, whether it is in detail, and the results, of course, the appropriate statistical analysis has been done. That is very, very important, because we cannot take just an article just like that and take it in the results and extrapolate it to our day-to-day practice. Yeah, very good. Interestingly, you have discussed about that.
Thank you.
Thank you. Yeah, very nice presentation, Dr. Kanakalakshmi, and critical appraisal was also very apt. Thank you, both of you, for doing a wonderful job.
Thank you. Thank you.
Thank you.
Thank you. Okay, then next we move on to a very interesting topic, that is how to write a paper. Being in a medical college, we see many of our postgraduates coming and asking how to write a paper. It cannot be said in a simple single statement, because it's an art. Writing a paper is an art, and how to write that, still many of us have a confusion, even though there are author's instructions, and how well we present a paper so that it can be accepted easily by any international or a national journal. So to highlight on this, we have Dr. Janani Dakshinamurthy. Welcome you, ma'am. She is a certified genetist and a genetic counselor at GNORA Private Limited. She is also adjunct professor Department of Pharmacology, Savita Institute of Medical and Technical Sciences, Chennai. So she is going to highlight us on how to write a paper. Over to you, ma'am.
Thank you, ma'am. And I thank the Indian Fertility Society as well as Rajapriya, ma'am. And am I audible, ma'am?
Yeah, you're audible.
Yes.
So thank you for organizing this, and thanking all the participants for spending their time here. So like ma'am said, like Radha ma'am said, this is it's an art. Writing a manuscript is an art. And before we could actually enter into the art of writing the manuscript, we've already seen how we are judged or critically appraised by the other readers who want to read or get information out of our manuscript. So I'm just starting with this. Why do we have to write a manuscript in the first place? So when we know the end goal, the process of doing it becomes a little more easier. So first thing is to communicate. Doing a research and keeping it within yourself is not going to benefit you or the society. The first thing is we need to tell the world what we are doing and what are the results out of it. So it might help some researcher or some patient somewhere in the world. So that is the first reason which we write a manuscript for, and then we increase the chance of publication. A good manuscript has a higher chance of acceptance, and then critical thinking and analysis comes. So manuscript writing doesn't stop there. That gives a lead to another research or another article. So, it is just a part of the whole the whole picture. A part of it is only being represented in a manuscript. And then knowledge dissemination and career advancements. Yeah, so there are different types of manuscripts which we can see. One is the research article, two would be review articles, and third would be case studies. Research articles are very straightforward. They would just explain or present whatever basic research you have done and what are the outputs from the research. So that is very straightforward. Review articles, there are a lot of methods of review. One is the meta-analysis, which we just saw, systematic reviews, and there are other narrative reviews, literature-based reviews, and all those. So review articles have a different angle to it, depending on the review we are doing. The number of manuscripts you need to choose for a review becomes important. So we are in an era of evidence-based medicine, and all the evidence-based medicine are decided by the Cochrane with their review databases. So in those cases, such a Cochrane or systematic review, very meticulously it is done. A lot of parameters and tools are being used for it. So since it is very huge, I'm not going to touch into review articles. We will just look at how to write research articles. And case reports are when you find something very distinguished or peculiar in a routine practice, when there is something which you go out of the way from the routine practice to solve a case, and that is when you would have to report it. Because so me being a geneticist, basically, we find that a lot of mutations are very new. They're not already available in the databases. So there might be a lot of areas where a different approach is given to solve the case. So all those different approaches or different tools being used can be recorded using our case reports. And how to structure a manuscript. So that's very important. Manuscript cannot just be a bunch of words put together and let out for reading. So when you have to write a manuscript, you need to understand that it has a structure to it. Usually a journal gives its structure, but generally for a research article, this is a structure. First would be the title or the heading, and then you would have an abstract. The abstract can be it can be concise, and it can be structured or unstructured. And then you would have the introduction, methodology, results, discussion, conclusion, references. This is a structure in which you would read a manuscript or it is presented, but this is not the structure in which you write a manuscript. So when you have decided that you want to do a research or you want to write a manuscript, so you do not do a research simply to go waste. So when you've decided that you do a research, you aim to publish the work. So that is the ultimate aim. No, so it is, the aim would be to share the knowledge with the world. So first, when you start a research, your research structure should be put in a way that how a manuscript can be, just not one, you can have multiple manuscripts out of the research, but how to, what are the requirements, basic necessities a research publication would require. So the first thing which we would look at is a hypothesis. In this hypothesis, you have something called as null hypothesis and hypothesis. So when the hypothesis doesn't work, we call it as null hypothesis. So then when you've identified a problem, and that's when you do research to find a solution. So this problem and your interpretation of that problem is going to be a hypothesis. So that is what we are going to see. So for example, let's say in simple terms, having a lot of consuming a lot of table salt and your blood pressure. So we're going to see if these have any correlation. So your hypothesis is that consuming more table salt is going to increase your blood pressure. So that is my hypothesis. So if I get a negative result out of the end, so it is a null hypothesis. So first you need to fix this hypothesis and then you fix the objective. There's a difference between the hypothesis and the objective. Hypothesis is what you think, what you propose it can be. Objective is how you're planning to do it. So in that objective, you might want to measure the amount of number of times salt content a person is consuming, and you can measure the BP value. So that is your objective and how you're planning to do it. So there, that is where you set, you can have 2 or 3 objectives, not just one. And then once you have your hypothesis and then your objective, you frame the research question. So this research question, whichever is being framed, the answer to it is the conclusion or the result section of your manuscript. So that is how you frame the research question. So I keep telling that you might have 2 or 3 hypotheses, more than 2 or 3 objectives, then you need to split your paper. You have to make sure one manuscript addresses only one research questions. Otherwise, the content becomes too clumsy. Too much of information into the manuscript will not appease the reader, and the context which you're trying to convey may not be conveyed in a very clarity. So this is what you plan. This is how you plan to write your manuscript. So now once you've made your plan and then you're doing the research. So for the research, you have decided that you want to publish this work. So definitely your ethics and your regulatory affairs have to be taken care of. So once that's done, and then you perform the research and then you keep the recordings. The first step to write a manuscript would be to prepare the figures and tables out of the recordings, so the observations which you have. So first, when you have the observations are very raw data. Just you would be noting down patient 1, this much salt, this much blood pressure, and you'd just be recording it. It's just recording, it's just observations. You need to put it in a presentable form. Sometimes you might have to split the patients into groups, like the control groups and the study groups. And then within the study group, you might have 2 kind of patients, one with already, like for the same example, one with a known case of cardiac disorders and somebody who doesn't have cardiac disorders. So, you might have small subgroups also in between, and and you might want to compare each groups. So the odds ratio or the significant p-values between the groups may vary. So you need to structure this table from the observations or the recordings you have from the research. So that is why we always tell first, prepare your figures and your tables. Now you have this roughly prepared. Once you have the figures and tables done, this will help you write your methods. So based on the tables and the results you have, and also you have already done the research in a workflow. So you would know first methods usually need socio-democratic informations like the subjects you have chosen, their parameters and everything. And apart from that, your experimental sequence. So this sequence will depend on the table or the figures which you have planned to represent. Unnecessary sequence can be avoided over there. And then with the methods framed in mind, and then you write them in detail. Sometimes it is always good or nice to give subheadings to the methods. Like for first, you can give subjects, and then you can describe about the study cohort. Then second, you can give the protocol of how you have made the recordings. Third, you can give another subheading and say what you've done over there. Fourth, you can give another subheading for statistical analysis and say what's done over there. So now you already have a subheading. Now, when you write your results, it is better to stick to the same subheading. You can give almost a similar subheading in your results so that the readers are able to correlate between the method and the results obtained from the method. And then this is how you write clear results. So results are just observation. You're just representing whatever data you have. You will not interpret what you get from this in your results section. You will have to just plainly represent whatever data you have in your results section. Now, once your results section is over, the discussion can more or less match the subheadings which you have given in the results and methods. Here is where we try to correlate or interpret our results. And we do not interpret the results from our brain, but we refer a lot of literature to give this interpretation. So here is where you would discuss that this is what you've got, and this is how the others have also got, and this is what you interpret from this. So that is where your discussion goes, where a lot of references are being put in. So now with the starting of a lot of references, you will start your references in a separate document where as and when you keep putting the references, you just put either a PubMed PMID or you just give it a number, and then you start adding those references in another document separately so that you do not miss anything, because tracing back a reference is a very tedious job after you complete the manuscript. So now you're writing the discussions with a lot of reference and a lot of citations, and then you have the references being separately maintained in other documents. And if for manuscripts, it's okay, but if you're writing a thesis or something, we have some reference managers like Mendeley's and OneNote and all those. We can make use of those reference or citation managers. And then once you have the discussion done, the discussion is different from results. So what we interpret and what we give as results are totally different. So conclusions or results they have to be given separately. And the discussions, the last paragraph is something which I wanted to tell you. You would put in more questions. It is always good to tell that what are your limitations already. That will be a second last paragraph. You can tell these points we couldn't cover and these are the limitations in my work. And then the last paragraph of the discussion, you can tell these are the areas or avenues where more research can be done, or the research can be continued from wherever you have stopped, the other avenues of research from there. So, when you do the research work, a lot of observations you must have done, and while you're trying to search for some literature, you would find that this information is not available in the database. So such avenues can be made a point over there that even yourself, or even you can put that this limitations is there, it can be covered through this method. Myself and my team, we have started research on this. You can even put that is also okay. So the other avenues or other broader aspects of the research can be put in the last part of your discussion. And the conclusion should answer the research question. So that is your research question. It has to be answered over there. Once you're done with this, we will write the introduction after that. For the introduction, for the introduction, you will have to keeping the results and the discussion context. We will write the introduction. So I'll just come there. Before that, there are some guidelines for tables, like we would not give repetitive tables, which is not really appealing to the reader. And dividing the data is always good. You don't have to put every data into one table, and then we can watch the extent of data in the tables. And it should be very precise. Figures, clarity is very important. We do have a lot of tools to draw your figures, like, there are some tools just to draw biological images, like BioRender, and they're all free tools where it already has inbuilt, it's like PPT, where it has inbuilt elements like cells, like receptors, ligands, and all those. So, we can make use of such tools to create good quality biological images. And sometimes the graphs might require some R language and coding. So that in that case, you can take help from an expert. And methods, like I just said, we should be very careful of, while writing the methods, some things which we have to keep in mind is your short forms. Your abbreviations, standard abbreviations have to be used, and the chemical name should be given, and whatever instruments you're using, the instruments have to be referred to their original manufacturer, and that has to be given. And so, methods like every instrument, every chemical we use, everything which we do, that the precise name, the standard format has to be used for it. Only then somebody else who's trying to replicate our work will be able to do it. And then results, like I said, we can have subdivisions. And for results is where we have a lot of statistics within it. So usually the most common or the simplest statistics which we would use are mean, median, mode. That is like the average. It is just means that to average, okay? And that has a standard deviation also. Standard deviation, if you can see here, I am so sorry. So if you can see here, standard deviation. So what is whatever data we have observed, it is within a range, and we might have some outliers, like really erratic values which we have observed. So they're outliers. So that is where we give that liberty, that standard deviation is given. And apart from that, a little more advanced statistics usually involves a p-value in it. So now when it comes to p-value, it states the significance. That is, when we have two groups, if the result we have observed is actually significantly different between the control and the cases group, that means there's a significance difference. The research is good, or the research hypothesis is good. So that is what we try to convey over there. And if you can see, I've given odds ratio, chi-square, logistic regression, correlation. All this, it is expressed in terms of p-values only, but they all have different meaning. So odds ratio is very simple. You have a control group, you have a case group. And then when you want to compare, if there's a difference between these two groups, if in case the treatment given to them works better for this. So, if just to compare and find out if there's a difference between the two groups, we can use odds ratio. And chi-square is when you have chi-square and logistic regression are almost same. It is like, again, comparing two groups with a treatment or something. But chi-square has definitive values in the sense that you can categorize the values in a chi-square. But when the values are continuous, you cannot categorize them properly. That is when we use logistic regression. And logistic regression usually gives us a model for prediction, or it gives us a model. It's usually a predictive model. It gives us a predictive model to see if the treatment being given or the drug dosage being given is good, or it's working or not working. This model would work for a treatment regimen. And correlation is like confirming that model. That is where you have a confirmatory assay. So this is how usually the statistics are built. It can start from odd ratio and go until correlation. And like I said, mean is basically the average of it. And discussion and conclusion, like I said, it has to interpret your results by comparing it with the literature which is already available. And then introduction. So when it comes to introduction, now we've written until discussion. Okay. So with this context in mind, whatever is most relevant to the introduction, that is what we should keep it on introduction. So if we start writing introduction, can go on to pages. So we have to be very precise, very accurate, and keep it really short. More than a page of introduction is not really good. So to keep this, we are just going to talk about, we are just going to introduce whatever disease or disorder we are going to talk about. And then after introducing it, any standard criteria to screen the disease can be also put in here. And then what is the problem which we have identified in this disease, some literature to support the problem which we have identified, and how are we proposing to solve the problem. Our hypothesis can be given at the end of the introduction. And with this, this has to actually match your discussion. So, a discussion would be a continuation of your introduction. And now we have written the introduction, materials and methods, your results, and your discussion. The whole paper is ready. The manuscript is ready. Now, once this manuscript is ready, only then sit to write your abstract. Because I usually tell abstract is your advertising. It is how you sell your manuscript. So just writing a manuscript, getting it published is not enough. We need to have more number of citations also for our manuscript. Only then the value of that manuscript would go up. So, and to increase the visibility of your manuscript, the abstract has to be really good. And a lot of us, we do not read the whole manuscript in the first. We have to choose a manuscript for our review article, for some meta-analysis or systemic analysis. We would not read the whole manuscript. We would just read the abstract first and see if this is a potential candidate, if it can be included in our analysis. So, if your paper needs to find a place in the evidence-based medicine, the abstract has to be really precise and really good. Only then it will be considered in the decision-making process. So for that, you need to make such good abstracts. And some journals prefer a structured abstracts. They have their own format, like give the subjects you have used, give the materials you have used, give the protocol you've used, give the results. So, it's very easy. Otherwise, 250 words of descriptive abstract, it is better to stick to the same structured format, but in a flow. So, and then, like I said, this is the abstract is the advertisement of your manuscript. It is good, or it is better to use simple terms, so language which anybody who's screening a manuscript for, it is good to use such small terms, simple terms, straightforward terms in your abstract. And only standard abbreviations can be used. Otherwise, you cannot make any new abbreviations in the abstract. And the word limit is very important for an abstract. When they say 250 words, you cannot go beyond the 250 or 200 words, whatever the manuscript says. Now, once the abstract is done, and then you have this, and with the abstracts, after writing the abstracts, you need to write the keywords for your abstract. So keywords are something which we call as SEO terms, such a Google search or an NCBI search might pick up when somebody is searching for your abstract. In the recent trend, something like the hashtags which we use in Instagram. So that is what we call as keywords. So, and that would be the most important aspects from your research question. Those important words would be used over there. And once all this is done, very important SEO terms would be your title. So when we are searching for a title on the NCBI, when our title has similar words, only then it will be picked up and published by a PubMed or an Google Scholar site. So we need to keep our heading very clear, concise. It doesn't matter if it is a little longer than one line also, but giving a clear descriptive title is very important. And then references and acknowledgements. It's always nice to acknowledge whoever has helped you throughout the journey of your research, and always acknowledge your funding bodies if you have any funds. And then references, like I said, we've already kept it in a separate document, or you can use a software like EndNote or Mendeley. And every journal has their own format for reference. You can check the journal. Sometimes these softwares are linked to the journal. So you can just have to, when you say, this is a journal you're submitting to, they will automatically change the format of the reference and then give it to you. So now I've given you the steps of writing the manuscript, but I said before we write, we need to plan for the manuscript. So how do we usually gather information for this planning? Is conducting a literature review first. And then you can also talk to experts in the field, like your mentors, your guides, and sometimes you can even communicate with the scientists around the world who have published in a similar title. You can talk to them and get their ideas also. And then you need to collect data. So before we actually collect our own research data, we need to see what data is available on the database. Repeating things are not really advisable. So we know, when we know what is available, then what we collect and what we present would be in a little more novel. So that is what everybody would expect to see. And then organizing and analyzing data is a task. Definitely it's a task. If it's simple odds ratio, anybody can get it done. But then we do go until our statistics and our programmed statistics and our created visuals also for representing some images. So in those places, you can always take the help of a biostatistician institute and some other art programmers who also help in this services. And then you need to write and revise. So once you finish writing, maybe you can give it 2 to 3 revisions. When you read your own manuscript, you would feel like changing some points, and then you can write and revise before you are until you're really happy with your information. And this is just a small tip. So you need to organize your thoughts before you start writing itself. And then you can just put a rough flow chart, just organize how you can just structure your manuscript. And then it is always okay to use very simple languages. That has to be in good English, but use a very simple language. It has to be clear, very directive. Nothing, you don't need to beat the bush, you can just directly say whatever you want to say. And then we usually use active voice for the introduction discussion, like we are talking or narrating it to the reader. And usually passive voice is used for the other subject. Usually methods are something which we have already finished doing. So we use a passive voice over there. And then it's better to avoid jargon terms, and the formatting and style, it is better to be consistent. And always for this formatting and styling, you can refer. So before you actually also do this, there's another sector. You can also identify your target journals from Springer's or Springer databases or Elsevier databases. And sometimes when you have these group of publications, if it is Springer, they have one pattern. They all follow almost a similar pattern. If it's going to be Nature's, then they all follow one kind of pattern. If it is AAS, they all follow one pattern. So at least if you can identify which journal or which group of journals you're giving to, the formatting style will be almost same for everything. So you can at least maintain that, and minute corrections can be done before submitting it to the journal. And while searching for a journal, an important point you should keep in mind is you should be able to evaluate your own work. Sometimes the manuscript is ranked based on its impact factor. So the impact factor has a lot of points behind it, how they rank a journal. Rank a journal and its articles. When you know the weightage of your journal, the weightage mostly depends on the topic you've chosen. If it's a very common topic, or if it is of a hot topic, a hot research area. Second thing would be the technology behind it. So if it's a very novel technology, very new technology like the genetics, AI, big data, machine learning, or if it's a very old technology, so that again gives weightage to the paper. Third area where it is valued is the sample size. For a small sample size, the weightage of paper is low. For a larger sample size, the weightage of the paper is high. And sometimes the sample size can be hereditary basis also. It adds a little more weightage to it. So based on all this, you try to see in that particular journal which you choose, how have the published articles, how are they weighted based on this? So with this, comparing your article with this already published articles, you will be able to find out if your article is the best fit for that journal or not. Now, this is how you screen and pick a journal. Once you pick a journal, then you can do the formatting and styling of your manuscript. So some common mistakes you should avoid is, abstract. Like I said, poorly written abstract, it is not even read by half of the scientific community. Your literature review should be adequate. You would try to add new literature into it. We do not usually consider really old literature. Keep it just for the past 3 years. And then inconsistent formatting. Formatting should be neat. You cannot keep mixing up the tense of your language. And then overuse of jargon terms or acronyms, and insufficient data analysis. For some places, like Sir just said, some places we need to do a correlation analysis. The correlation analysis has to be done. Even if you're not an expert in it, you can take the help of a biostatistician and do the correlation analysis. For some things, if odds ratio is enough to make a decision, then that would be enough. So, that insufficient data analysis is a common reason for rejection of manuscripts. So I am done and I'm happy to take questions.
Thank you very much, Janani, for enlightening us. It was well said. And I hope many of our participants are benefited by this. I have a question for you. Do you write an article and then search for a journal, or you search a journal and go through their instructions and then start writing? Because many of the times we have seen that we try to write and we want to publish in a journal, and based on that instructions we write. At times it may not be accepted because it is not the interest of the journal. So when we send it to another journal, again, we have to do a little bit of formatting and change the pattern. So what is your opinion on that?
Yes, ma'am. So we should not bias our article based on the journal and their requirements. So we need to convey our research clearly to the world. So first you write, make it the basic format. You give the introduction, methods, results, and discussion, and then choose a journal which is more apt for your article. Rather than, it is not about publishing in that journal. It is about conveying what you wanted to do, what research we have done to the scientific community.
Okay. It was
And I
very
think if I
nice.
can get your question closely, the formats of different journals will vary. So it is the
Yeah.
same article, same study, but the formats how they have to submit, and the formats how they have to adjust a bibliography and write your results, write your tables differ. I think that is what Madam is asking.
Yeah, because many times we are facing that when we send it and they say, no, this is not suitable. Again, we are rewriting the article, maybe in the format what they're giving. So I used to think whether we should write, first we select a journal which we want to, and then follow their instructions, in what order they want. Some have the words limit. So we have to restrict to that, and number of tables, so that we keep that in mind. Probably then we can write. At times we write everything in a table or a graph, and some of them, they want it in a different way. Then to rewrite it, it becomes little different.
Yeah. So what happens is when you already have a journal in mind and then you're formatting your article to it, and in case they reject it, you'll have to redo the whole article from the first to match.
That is what.
So that is why I said before actually formatting a journal, once you write a rough copy with the IMRAD format, the introduction, materials, results, and discussion, that is your basic copy. And then while you're styling it or formatting the whole set, that is when you look at the journal, you choose a journal and you put it onto their format, because we cannot be sure, first itself we have one journal in mind and we do everything for the journal, then they reject it. There are high chances they will reject us. Then you'll have to do everything from the scratch. So when you have a base copy or your copy in hand, it is easy to format them according to different journals.
Yeah, okay. And well said that abstract is a very important thing, which most of them, they neglect. And do you think abstract has to be written first, or the journal article should be, the paper should be written and then we can write the abstract?
No, abstract is preferably in the last, because, by the time you finish writing your article, you become a pioneer in that subject. And that is when you have already done a lot of literature review and you know what are the keywords which the other authors have used, and how you itself have searched for those articles. You must have used some words, and only then you become really, very used to those words and those kind of lines. So, and that is when we will use those words in our abstract. And only then it picks up in a Google search.
Yeah, and one more thing you said is that you use references in the last 3 years.
Yes.
But at times, we get a lot of information in the articles which are more than 5 years. And even the latest publication, the journals, they say you have to use only the latest. So in those situations, we cannot express our things without quoting their references. So then there is a query. So how do you take that?
So sometimes some articles are gold standard, like Mendelian's law. That is the paper.
Yeah.
So for gold standards, you will use the oldest papers, but then it is always advisable to use the last 3 papers, and then you're not use, like you said, the information is available 5 years before. And when you put it on PubMed, usually below that article, there is something called as article citing this manuscript.
Yeah.
They would have an advancement. They would cite the information, whichever you have seen in that old article, 10 years old article you have seen. They would have an updation, or they would have some add-on points to that manuscript, and they would have published it recently. So it is always advisable to use the recent publication because they already have an update to it. So you will have to give an update after that.
Okay. I think we have covered almost everything, and it was very useful. Hope all the participants take the advantage, utilize this, and start writing a paper. Thank you very much.
Anybody, if they want in future also, ma'am, no worries.
Yeah, sure. Thank you so much. Okay. I think we will move on to the last session that is very important. After we write a paper and we send it for a publication, then there is another question about authorship, and most of the journals, they don't accept without the plagiarism, the printout. So that is becoming very, very important. So we will move on to that. To enlighten on that, we have Professor Pankaj Shah, Sir, he is a professor and head of the Department of Community Medicine at Sri Ramchandra Medical College and the Research Institute Srihar. And he is co-convener for NMC courses at SRMC, and which is a nodal center. And he is a member of various committees. I've seen him actively participating in so many committees. And he's also an author. Sorry for that. He is also an author and reviewer of the Cochrane systematic reviews and meta-analysis. Very, very nice to hear that, sir. So you will be the best person to tell us about this plagiarism and all that. And he has a vast research experience. So he is going to talk to us on authorship and plagiarism. Over to you, sir.
Thank you, madam. Thank you for the opportunity. Actually, there is some amount of rain outside, and that's why there is no power, and I'm working on backup right now. So anytime if I get disconnected, please inform me. And for the same reason, I'm working on right now on portable hotspot of my mobile phone. So I'll just switch off my video so that it saves my bandwidth as well as the quality of audio may be better.
Okay, sir. Sure, sir.
Yeah, thank you. I'll just share my screen. You are able to see my full screen right now, correct?
No, sir.
Not it, sir.
Okay.
Yeah, now we are able to see you.
Okay. What I plan to do is just to take some important take-home messages on this important aspect of authorship and plagiarism. Before I start, some amount of disclaimer saying that probably 30-40 minutes what we are going to discuss may not make us expert, and probably we need to move on. And every time we do on these aspects, naturally our experience will increase more and more. Now, as you know, authorship is one of the important aspects, especially for the faculties and the researchers for their promotion and improving their CV. And also the plagiarism makes a big important issues, because naturally whatever reputation a researcher has built up can be scratched in few seconds. I will just take you to the guideline, which is always available as one of the thing, and which is recently updated in May 2023 by the International Journal of Medical Editors. And it gives a recommendation for conduct, reporting, editing, and publication of the scholarly work in medical journals. And whatever aspects are required, all are detailed described in this article, which is updated and is available on the website. So I will just take the important aspect of authorship from these guidelines which are available. Now, as you know, authorship is one of the primary important responsibility when we conduct the research, as well as when we write a manuscript as well as report. When we are doing corresponding with the journal, author again become responsible, which is a corresponding author. And in future, if there is any query or there is any discussion or any further collaboration, authors play an important role. Now, author can be a single author written paper, or it can be a multiple authors or the collaborative work by multiple institutions across the different states of India or across various countries in the globe. As just in the previous session, we were talking about different kind of articles. Basically, the principle of authorship will remain the same, almost all kind of articles we are talking about. And as I was talking about, the International Committee of Medical Journal Editors recommends the 4 important criteria. And these 4 important criteria are very, very important in the sense that all 4 criteria have to be satisfied for someone to be called as an author in a particular project, and most important, in the final manuscript which is being written for publication and gets accepted in a particular journal. Now, if you see, before I go through the criteria, that is the 1, 2, 3, 4, everywhere the red color highlight I have given is end. That means all these 4 criteria have to be satisfied by a person to become the author of that particular article. Now, first and foremost important, substantial contribution to the conception, or the design of the work, or acquisition, or analysis, or interpretation work. This is the first important component which gives importance to the planning of the research project at the conception level, at the design level, at the data collection level, at the analysis level, and also importantly, interpretation of the data. Again, to important highlight, the role of author does not end here. It adds the word to end. Draft the work and review critically the intellectual content written in the form of a manuscript or the report. Also, in addition to end, final approval of the version which to be published. And the most important, this last criteria got added probably a decade back. Earlier, only 3 criteria were there. And the last important criteria is the most important, where all the authors agree to the accountability. And the most important word here is all the aspects of the work in ensuring the questions related to the accuracy or integrity of any part of the work are appropriately investigated and resolved. That means, as per this, a person need to satisfy all 4 criteria. Start at the planning stage, writing and reviewing the draft critically, looking at the final version, and the most important, the person is accountable to the all aspects. Earlier, there was a time when some component is done by one author, another component is done by another author, and we used to can say as the part of the contribution to the author that this particular part is probably that particular author is responsible. But here the guidelines are revised over a decade back, which says that all the aspects of the work we have to be accountable whenever the accuracy or integrity is asked. And that's why this all 4 criteria have to be satisfied. A particular researcher or a faculty who do not satisfy any of this criteria, even single one, will become the part of the acknowledgement rather than becoming an author. Here, the most important word is the accountability on the complete work. And that's why each and every author has enough confidence among their co-authors for their integrity, because there is a possibility the work is being done by a multiple group of people. And when this whole research work, where multiple group of people are involved, we have confidentiality as well as we have integrity aspect among the co-authors. We have a faith in them that all people are having a good integrity and all are becoming equally accountable for the complete manuscript. In case of a single author article, this may not be applicable because there is a single author, but largely world is moving towards the multi-author study, multi-country study, and multi-institutional study, and hence the accountability is more important. Again, to re-emphasize, all 4 criteria of the authorship is required. That means plan from the beginning. The person was involved in the designing of the study, conception, data collection, analysis, then reviewing the first draft, second draft, then final version of the draft, and being accountable for the all components. That means the person was involved almost in the entire component of the research project. Anybody who doesn't fit in any one criteria also has to move into the list of acknowledgement. Whenever somebody is acknowledged, it's always better to take approval or consent or the permission from the particular person about the acknowledgement that we are going to acknowledge them. This authorship criteria, the purpose is to serve those who really deserve the credit and take the responsibility of the complete work. So if you see the guideline, it largely talks about the 4 criteria. It talks about the accountability. It talks about the responsibility, and hence the authorship really plays an important role, because tomorrow these aspects are going to be published and are going to be part of the guidelines, are going to be part of the practice, clinical practice, and it's have a lot of implication in practice and implication for research, future research. Just to give a classical example, few years back, just recently, when COVID was there was an article published with the hydroxychloroquine as one of the important aspects for the treatment of COVID, and there were a lot of issues, and some of the articles related to COVID treatment and the drugs were retracted back, because though it was published, because as the fast mode of publication, as everybody was looking for the COVID related treatment modalities, etc. But at the same time, there were issues with the manuscripts, issues with the data collection, data analysis, and so many things. And even the article retraction has also happened before COVID also for many of the authors because of n number of issues. Now, classically, one common issues which is coming up is also image duplication or image reprinting. This plays an important role when we are looking at it, because building a reputation takes time, but unfortunately scratching a reputation and retraction of the articles really in few seconds can spoil the image of the individual or the faculty or a researcher. Hence, all these aspects of the accountability as the author is very, very important. Second important component comes is when authors are working in a group, they need to decide, preferably in advance, before even starting the project, which are the list of publications which are going to be coming, how many publications are going to be coming, and how the authors will be listed in the order or the byline, so that there is no friction or any issue comes up at a later stage when the authorships are being worked out in the final manuscript. And it has to be decided collectively with consensus by the group of authors who are involved. There are various patterns. Some of the journals may put in alphabetical order. Some journals may like to put as per the order of their contribution. And many of the international places, the last author is actually the person who is a corresponding author or who takes the complete importance to that authorship. When it comes to India, a few years back, we had first author, second author, third author, and then first or second author and corresponding author. These kind of criteria were given for the promotion by Medical Council of India. And in the recent revised guideline by NMC on the teachers' qualification, that first, second, and third and corresponding authors is no longer available. And it largely talks about the contribution. Earlier guidelines were talking about those authorship as important. The latest guideline has not given any specific idea with the place of authorship. Regulatory bodies have their own way how the importance is given to a particular article. Some look at the publication in a high impact journal. Some look at the citation which are coming up after the article is published, so that how valuable that particular research was important. There are a group of people who work together at institutional level, at multi-institutional level, or at probably international level, and they work as a collaborative group. They may have a group name, say for example, Indian Infertility Management Group, or take the example of Indian Diabetics Management Group, or maybe International Diabetes Group. They work in a collaboration, and those collaborative group also can become an author as a collective author, where there'll be no first, second, third author. The whole group name will be there in a PubMed Central or any of the indexing databases, as well as the journal article, and all authors and contributors' name will be arranged in a specific format or maybe alphabetically. Publication of a research is very, very important. Anything probably which is not published after doing it is a kind of unethical science, because it has to come into the light in the form of a good practice or probably a limitations which gives an idea for the future research, or some of the practice which are being continuously used. Probably now with the latest improvement, we realize that probably some kind of a modification is required. Now, as multiple authors are available in many of the research projects, except the single author manuscript, there has to be a corresponding author. Now, role of the corresponding author is very, very important. This author has to satisfy those 4 criteria like any other author, but also primary takes the responsibility of the complete accountability of the research. And the most important is going to be involved in all kind of correspondence with the journal, with the editor and the editorial board, with respect to submission, with respect to review aspects, with the review queries, putting all the things in place, submission on timeline, and then review once done. It has to be submitted with all those kind of timelines. The corresponding author's role is largely very, very important, and that's why many of the organizations give a lot of importance to a person who is involved in the research as a corresponding author. There are various patterns of the corresponding author. Sometimes it is looked at the senior most person who is directly involved in the corresponding authorship. or the person who is going to be largely knows about the whole research project can become the corresponding author. Now, as I told you, authorship is very, very important. Now, the guideline which I was talking about of updated in May 2023 has special section on the authorship with respect to artificial intelligence. As you are aware, last couple of days, ChatGPT and many other softwares have come into picture who gives a lot of information in an articulated human intelligence way of writing, and even large content of a long essay, short essay, exams, and even research proposal and research paper with the references can be written with the artificial intelligence. Now, first and foremost, we need to understand there's a lot of rumor going on around in social media that this artificial intelligence softwares or the application can become an author. That is not possible, because the most important aspect of the guidelines we have seen so far is the accountability and responsibility. And this guideline in this 2023 May update has very clearly said that whenever these AI models are going to be used, the author has to describe very clearly how they were used. Is for description, is for image creation, or whatever has to be clearly told. They cannot be called as an author at any point of time, and they cannot be called as an author because they, for the accuracy, integrity, and originality of the work and responsibilities which a particular author needs to take as per the author is required. And hence, humans are only can be authors, and this AI assisted technology can only help in probably a writing manuscript in a better way or something like that. Something more than probably a reference manual or the reference book or the review of literature. And that's why whatever the output is generated by these artificial intelligence softwares have to be reviewed critically by the authors whose names are going to be there as the authorship article, though it is a auto-generative, auto mode, because something can be incorrect, something can be incomplete, and something can be unbiased. Recently in the media, there was news going on that some of the things which are available through these kind of artificial intelligence output were actually the fake in nature, but it's very difficult. Sometimes they are also incomplete in nature because they were updated only till 2021 and all, and they may be also biased in various reasons because they actually got trained with the resource material which is available with the particular system. If those resource material under which this artificial intelligence softwares are trained, if they are biased, naturally that output has to be biased. So in short, though these outputs may help you for the author to write some amount of the manuscript, get the information, get the detail, but should not be going beyond, as we are reviewing in a current scenario, a reference of a book or a reference of an article or a journal article. This AI softwares cannot be the author because they cannot have accountability and integrity and the originality of work, and finally responsible. And also, as authors, have to critically review those outputs which are generated by them to make sure they are all correct, not incomplete, and not biased. Again, to overemphasize, they cannot be an author or a co-author or etc. Many times the problem may come with called as plagiarism. We need to understand these artificial intelligence softwares are trained on some resources. Now, these resources will have their own copyright or without copyright. They can be directly copied material, and all those can be there. So the output which has generated may have some issues of the plagiarism, which we need to check it. Many times it is being said the output which is generated by artificial intelligence kind of a software. Plagiarism check is relatively difficult in the current scenario of the softwares which are available, and people are working on technology where this outputs also can be found out if they are really plagiarized or not plagiarized. Humans must ensure that the appropriate attribution to all quoted material are included as full citation and correct, because this may or may not be possible with the artificial intelligence software. Now, coming to the related aspect of plagiarism, there are free softwares are available, and there is some amount of danger when we use the free software, because I have classically seen faculty at a younger level or faculty who do not have access to the some kind of a university based or own plagiarism software. They try to use the free software. Unfortunately, many of these free software which are available on internet also unfortunately store the data. In that, if they store the data and finally you submit to a journal and the journal try to look at the plagiarism, there is a possibility it may found that same stored data which was checked by the person earlier, and it will shown as a plagiarized. And hence it's better to avoid all kind of free software unless we are 100% sure there is no saving and the quality is good, because many of the softwares may not be of the good quality. UGC earlier came with the guideline that we should have a Uncruit kind of a software, and recently it got converted into a so-called original software which is available with many of the universities, including our university. One of the best software which is available is probably Authenticate software. Now here we need to understand that though we talk about plagiarism, actually this software will not tell if something is cut, copy, paste or the plagiarized content. It will only tell how much is the similarity of a particular manuscript which is submitted with the already available manuscript which is available in the public domain in internet. Something probably which is available in the book format, but probably is not available in the online. Naturally, it will not be able to check, because all the resources what a software check here is only from the online available resources what that particular software has. Authenticate has a larger access to the more of resources compared to other resources. So we'll just see how this software looks like and what is the guideline of UGC. So now if you go to the UGC guideline, it was published as a Gazette notification on 31st July. It talks about similarity. We need to understand, though plagiarism is kind of a misconduct where things are copied, ideas are copied of somebody else, and we are quoting those things as our own. But actually, when this software looks at it, the content which is written, how similar that content is to already available content in the public domain. So finally, when the report is generated, what it will give you in the form of percentage similarity. Now, there are two kind of components will come. The overall, when the document is submitted for any kind of its checking, it will give you overall similarity, say 10%, 5%, and say 20% or 90%. And then you can decide. Now, say for example, I want to write the ethics committee approval was obtained for this research project. I don't know there is any other way. How different way we need to use our human intelligence to say that this is not a plagiarized content, though it looks similar, but it is not a plagiarized content. Same way, when we look at the methodology, many of the procedures, how to be doing it in a sampling or in statistics or lab sciences or any kind of procedure, which is a standard practice. If we are going to take as a copied material from somewhere, then again the percentage is high, and actually is not the copied material. The author has cited from where they got that particular methodology. If it is probably a standard practice, may not be cited, say Apgar score, probably does not need a citation, but probably a varied kind of methodology is better to cite. And whenever citation is given, naturally, though this particular paragraph or methodology looks similar to already available methodology of a staining in another paper, should not be considered as similar. That means once the similarity report is available, we need to go into each and every aspect and look at those aspects, how they are really similar, or a cut copy paste kind of material or ideas or the written material of somebody else which is not cited and claimed to be owned. That kind of percentage has to be coming. So it's not what the report generate percentage. We need to read line by line, word by word, and decide really it is a plagiarized content or it's just similar. And the citations are given a common methodology, common terminology, common knowledge, which cannot be considered as a plagiarized. Say Newton's first law. Everybody knows what is the Newton's first law. It is written that in the same word, definition, at time we have to write in the same thing with inverted commas, and the citation has to be given. After applying the human intelligence, that what is really copied and what is really not owned and claimed by own, then only the percentage comes into picture, where it is called as 10%. Just don't take blind percentage as the first report comes. go into the minute detail. Once the thorough analysis is there, what is copied, what is not copied, what is own idea, what is not own idea, what should not be counted as similar because that's a common knowledge which is available or common methodology. After you delete all those components, then only the final percentage comes which needs to be copied as called as 0 level, which is 10%. If it's level 1, then it is 10 to 40. If level 2 is 40 to 60 and level 3 is 60%. Anything after thorough analysis of the report less than 10 is really good. And universities have various guidelines, and UGC in this Gazette notification had prescribed how the those issues where the plagiarism content appears to be higher, how needs to be handled, and various committees have to function. Same way, UGC has come out with a specific guideline with these kind of practices of authorship and plagiarism. Is called as Good Academic Research Practices Guideline of September 2020, and we can look into a detailed aspect of that. The original, which was earlier, if I'm not wrong, it was called as UNCRUD through UGC, one of the prescribed, and it is available in many of the universities. And what you do, there should be a login. Once you have a login and password, you need to submit your Word file, PDF file, and the multiple formats are permitted. Once that is submitted, it takes sometimes few seconds, sometimes maybe few minutes or few hours, and the report is generated, which is a common report. In totality will give the common percentage. Then we need to look at what are the materials where it is cited as the similar, and we need to really look all those items at the minute detail and decide really they are similar or they have to be similar, and really there is no plagiarism kind of thing. It is just a same word or a common knowledge is there. We need to delete those components and then only come to the final percentage. Sometimes I have seen many times when people have their own user ID, password, or department, they keep trying it multiple times. That means I have written probably a introduction in methodology and I want to check the plagiarism because the software access to I have. Then afterwards I finish my results and again try uploading the complete file with introduction, methodology, and result. In such scenario, when a particular file which is of a same article or same manuscript uploaded multiple times, the previous file remains stored in the database. And when it stores in the database, what happens? It takes as 100% similarity from the previous article. And hence my request will be always look at these kind of software when largely almost 95 to 99% of the article is fully written. I will just take you to a small video. I hope the audio of this YouTube video will be available and audible. In case it's not audible, I can explain you.
Hi everyone, I'm Jamie.
Please, can somebody confirm if the audio was really audible to the audience?
Yes, sir, it's audible.
Okay, then we'll just go through it. So now what I will do, I'll just stop in between. This, I have a user ID and password. I have submitted the documents. After few minutes, few seconds, or few hours, I get a report. The first page of the report looks like this, where you see the different color coding indicates what kind of similarity is there. I'm repeatedly telling, when these softwares detect, they don't detect the plagiarism. They detect only the similarity, and a human intelligence has to come to decide that if it's really plagiarism or not. It also will give you here how much is the similarity text and what are the warnings. First, you can click on the warning, look what are the warnings are there, and also on the similarity text so that you can directly jump to the paragraph where the window will be there. What is the actual manuscript and how similar from another manuscript, and the source of that manuscript will be there so that you can really decide it is really a plagiarized content or it is a common knowledge.
Product manager here at Original by Turnitin. Welcome to the training video for the new original analysis report. This will give you an overview of the new report, some of the main functionalities that have been delivered with the latest release. We'll start off by giving you a quick summary in terms of why we wanted to bring this release to you.
Now, if you see here, but this may not be the true similarity because we have not gone into the each and every component. Once we started looking at each and every component, then only we realize if that is less than 10%. Don't be happy that we got less than 10%, why we should read. Because even somewhere, if suppose there is one article and where I claim that this particular philosophy is I have invented. Now, actually, it is not me, it is by somebody else. Though it is 10%, but I have taken somebody's idea, which is not my idea, and no enough citation or the credit to the original author is given. And hence, even if the similarity is less than 10%, it has to be thoroughly investigated, thoroughly looked at.
And why we wanted to improve the existing analysis report. Our main objective was to ensure our users had the best ability to customize their experience while viewing the analysis report. When you view the report for the first time, you'll be presented with the Overview tab. This is very much a summary of the report. At the top of the page, you'll see we've got different tabs. This is your main navigation through the report interface. Throughout the report, you'll see some information around the submission itself and the submitter. And we include the submitter name, email address, the percentage similarity of the submitted work, the number of words, date of the submission, and the submission ID. Now, moving slightly down through the report, we can see at a high level a summary of the number of pages within the document that were flagged by original. And you'll see here each of these bars represents the pages in which we detected similarity to a source or a potential issue or warning in the submitted document. Further down the Overview tab,
wherever the things are not shaded, that means the similarities is not found.
you'll see we've got two additional components. The first one being the findings component, and in here, this is very much a roll-up of what our analysis found from that document. For example, here, we found 15 segments of matching text. We also identified 2 warnings within the document. Moving across to the right-hand side, we've got the similarity component, and this view changes depending on the number of submissions that have been received by that particular teacher or receiver. You can see the group average just below the current submission, and then finally on the right-hand side, you've got the submitter average, where we can pull the analysis together to show you what the average similarity percentage is for that student. From the findings component, you can actually click on the 15 matches, and what happens here is this will take you through to the next tab.
Now, when you have opened this, one of the 15 text boxes, it will reflect from 1 to 15. And you can keep on doing the next and next, and you can see all those 15 places. If you have clicked on 2 warnings, it would have taken to those 2 warnings. Now, this is the submitted document, and this is the document which looks similar to that. You need to see the content, what is written here, what is written here, is a plagiarized content or is a naturally similar. And also it took talk about the sources, which from which this original article, which looks to be appear to be similar from the submitted work, can be seen. And also, if you feel, as I was giving the example, the ethics committee approval was obtained, was written here, looks similar, and it increases my percentage, which actually is not to plagiarized content. Is the only way we can write. I can exclude this match. And when you exclude this match, naturally the percentage here will come down. And this kind of thorough looking has to be looked for all the matches, all the similarities, which looks here.
Here's the findings tab. The findings tab gives you a breakdown of all the matches that we've detected, and it provides you with an interface to navigate through them. What you'll see on the left-hand side is an extract from the submitted document, and then on the right-hand side, you have the actual source that has been matched against. In this example, the first match is from a source in the original archive, in this case from a different school or institution, and this means that you aren't permitted to show the matching text itself. If we look at match number 7, we can see that this is an online source, which is a clickable URL to the source itself. As you can see, we are here permitted to show the actual matching text. We also provide some metadata around the match.
Now, what happens here? The text appears to be similar, which will be looking like this kind of a color. It is similar, but we need to understand here there is one word which is not similar compared to what is here. Many times, unfortunately, what multiple authors do, that not to find out this similarity kind of thing in the software, they insert some kind of a different words in between to look it as if it is not a plagiarized content or the similar content. And also some of the times they put some kind of a asterisk marks or some kind of a symbols so that it cannot pick up. So what software does, whatever words are similar, it looks like. And in one of the guidelines is being said, if more than 8 words or 6 words are continuously looked similar, then we need to be worried. So here, if you see this appears
Dr. Pankaj, we are not able to hear you.
to be similar, but probably this word is not similar.
The report. The other option on the right-hand side is to exclude the match completely. And once we exclude that match, it's removed from the analysis. For example, when we exclude this particular match, still number 1, we will see that the newly included Wikipedia article is the new match.
If you see here, in the previous they excluded, so that the percentage will change. It may change marginally, or it may change larger component depending on how much similarity is showing. If you see this content here, I'm not reading it, but there's a possibility author might have played some kind of a trick by inserting multiple things so that it doesn't look similar. But software is good enough to catch up all those small words and letters which look similar, and then we need to decide it is really copied. Say, for example, if you see here, it is Wikipedia. This document probably by a student or something just copied from Wikipedia and inserted something so that it doesn't fit in the criteria of those 4 words or 6 words together and can be escaping it.
And if we exclude this one also, we can see that the overall similarity
Sir, we're not able to see your screen, sir.
Sorry, just 1 second.
In your analysis report. Next, we'll take a look at the sources tab. You can access this tab by the top navigation, and it includes a list of all the
Just
sources
give me
that
1
we've
minute.
identified in the
I think
process of analyzing the submitted documents.
I'm not able to
We
share
provide
my
this
screen.
for
There is something like that.
Send it back to the source, link out to the previous page. We can actually navigate directly to that source. To the
1
right-hand
second,
side
1
of the
second.
page,
Either
we
probably
have
I
a
got
visual
1
representation
second.
of where matches have occurred
I
in
got
the
logged
document.
out, or just 1 minute.
And at the very bottom of this
Now you are
page,
able to see?
we've got the option for you to add a missing
Yes,
source.
sir.
Yes,
Allows
sir.
you to
Okay, I'll just go back to
know that a
the,
particular source has been used.
I'll just,
And providers and the internet exclude the match completely. We will see.
I was explaining this. Now here, probably a student or somebody has just copied from a Wikipedia, and just to avoid taken by the software, multiple words and something are inserted, maybe in the form of a symbol or something. So we need to be really careful if it's a direct copied material and all. And then we need to decide it can be excluded or included in the analysis. So these kind of things will be available, and probably this website is available. We can go into the detailed component. Second important component is when we go into all the sources, we'll get the full list. Now, from this list, we can decide which to include or not to include. Suppose, as I was giving an example, I have submitted introduction and methodology. Then I wrote introduction, methodology, and result, and I'm again submitting. Though ideally, it is not a good idea to do it. But if suppose a student has done it, you can remove the complete source of that earlier paper, which is of the same paper, which I'm putting the revise, so that that kind of percentage will be reduced from the total percentage. So you decide to include or not to include. This is available from the source file. Now, this is another way of looking the complete paper on parallel thing, where it looks similar, where it doesn't look similar. But I will always advise, as the report is generated, first look at the warning. look at the total percentage, irrespective it is less than 10%, go through the whole similarity in great detail, look at those similar texts first, and then you can go individually at the full article at one glance. And this can go on. As far as this software is concerned, I am not sure if there is any higher version is available where you can probably give only introduction, exclude methodology, and then include result and other things. Only the possibility of excluding the match is available when the report is generated. But there are many software where we know this methodology, say a particular kind of a genetic analysis or staining or something, which has to be similar. There are ways we can remove it. Also, there are softwares which can remove the references, etc., which can be removed. So as I was telling you, another classical, the best probably software available is Authenticate. Now here, if you see, we'll not go into detail of the video. This is a free demo YouTube video which is available. It will also show in some kind of a similarity with the different sections which you can compare, and you decide to include or exclude. The one of the better aspect in this, a particular section also can be removed while making the comparison. So all those kind of comparison will give me only the similarity. It's only the similarities which is assessed by the software, and really understanding it is own idea or somebody's idea, or it is a cut copy paste material or is a plagiarized material, has to be done after the complete detailed analysis is there. And that's why there's a feature of inclusion and exclusion of this analysis from the report available. Now, only thing we need to remember, whenever we are using this software and we put our human intelligence to decide what is the final correct version, which is actually similar and which are the similarities which needs to be excluded, please download that copy and save it, because there are some of the softwares like original which will not rectify that correction, and the original percentage remains in the system. I'm not sure why this does not happen, and hence whenever you are doing that kind of excluding and including of all these similarities, whatever the final product is there, please download that PDF file so that that file remains with you, which is the final product as a researcher or as a guide, as a supervisor, which you can do it. As I was telling you, many of the software also may give you Authenticate. As I was telling you, please avoid using any kind of free softwares. Now, as a teacher, as a faculty, if I really want to find out if it is a plagiarized content or no, many times I personally feel a kind of a software is not required. I can just tell my student to write 1 or 2 paragraphs in front of me. Unfortunately, English is not our first language, and many times when the contents are plagiarized, are written in a very flowery, good quality of English by a person who has the English as a first language, naturally that kind of English flow and this kind of English flow will not match. And I can decide, say first paragraph written very good English, second paragraph is written in a probably not a very good English, means that it is written by the student, and this is not plagiarized, but the earlier first paragraph which was written is the plagiarized. Again, I can read the third and fourth paragraph and it can give me some kind of indirect indication how much things are plagiarized. I always tell my students, please read everything, write in your own words, so that kind of cut copy paste will not available. Whenever you are referring those articles, you are getting information from other sources, always give citation, so that it doesn't look like you are projecting as your own idea, and don't do blind cut copy paste at any point of time. The common knowledge or extra references will be cited, will not be considered as plagiarized. The common methodology will not be considered as plagiarized. Everything you are writing in own language, very unlikely it will be similar. And the common similar statements like ethics committee approval was obtained can be excluded from the whole analysis when it is done. It is really a great difficulty on part of anybody to rewrite the whole thing which is already written when the cut copy paste is done. We need to go through those UGC guidelines. Coming to again artificial intelligence softwares, many of the times this contains may be copied from the original sources which we are taken. Newer models are, newer softwares are coming which probably can detect. But again, the English pattern of writing, that output of the AI software and what kind of our English writing may be different. And when we read the whole article, we realize that many of the components are written in a different way of writing style, different way of presentation. Then naturally, probably either multiple authors have written, or probably it has taken from different sources, and then it may lead to some kind of a problem. some kind of a problem. So this is in short about two important topics we started with. That is the authorship and plagiarism. To summarize, authorship, a person has to fulfill the all four criteria, starting from design, data collection, planning, reviewing the multiple drafts, reviewing the and approving the final draft, and takes the complete accountability and responsibility. Any criteria not fulfilled, the person goes into the acknowledgement things. It is to make sure those who are really authors get the credit of it, and all kind of wrong authorships can be avoided. A corresponding author can be the most important person in the research, who knows about everything and most importantly corresponds with the editorial board and journal with kind of all kind of issues that are required. Artificial intelligence can write a lot of things, but we need to be careful because they cannot take accountability and responsibility like an author. They cannot be as a co-author, and we need to be very careful if the information is incomplete, information is biased, and information is wrong. And that's why each and every author again had to see and look at the complete accountability when it comes to these kind of outputs, and the complete detailed guidelines are available from the May 2023 updates of the International Medical Editors Journals guidelines which are available. Next important comes is the plagiarism. We need to understand anything which is a copied material where we are not giving citation to the or the credit to the original author or somebody else's idea is the plagiarism. But the softwares which are available only talks about the similarity. We need to look at those output and realize how much is similar as a common knowledge and how much is the copied material or other kind of ideas. We may go through the UGC guidelines, etc., where the academic research practices are available, as well as the Gazette notification available. And after thorough analysis, anything less than 10% can be considered as good. Anything more than 10%, we need to be worried of. Even in a simple report, gives a 10% or less than 10%, but still thorough analysis of the whole article has to be looked at, and not just merely at the output report. Though various softwares are available, some through UGC, some through university, some through the various channels, many of the journals, well-reputed journals, use the Authenticate kind of a software, and UGC has given a guideline for the plagiarism. UGC has put one additional guideline of self-plagiarism, where I have written one article earlier and I copied some component of that article in my next article, my third article, fourth article. So there are various guidelines. What cannot be considered as a self-plagiarism? What is self-plagiarism? Can I copy without giving citation? All those rules and regulation, even for the self-reporting of the same article, is required. In addition to is the copying of my original article. We also need to understand many times when we write articles and submit to journal, unless it is a common kind of a copyright-free publication, many times we give our copyright to the editor or the journal of that publication. So what happens once it is published? I do not have an original copyright for any of the content, as well as the images and graphs are which available. That means though it was my original research, if I have to publish somewhere else in another article or book, and the copyright is handed over to the journal, then I need to take again permission, though it was my earlier own product as a out of the research. And if the article is published in a common copyright-free kind of a journal, which is available, then self-plagiarism also becomes an important role when we will be calling it as a not self-plagiarism, and when it will be considered as a copied material from my previous article. And we need to be careful on those copyright issues also along.
We are not able to hear you, sir. Hello?
Yeah, ma'am, same with me also. I'm not able to hear, sir. Suddenly it went.
And
I'll try to call him once, ma'am. I have his number.
With plagiarism. Just
Sir,
to
we
summarize.
can't- Yeah.
Sorry, again, there was a disconnection. Please confirm if I was available.
Yes, sir, yes, you're audible. Sir.
Yes,
You're
sir.
audible.
Yes, sir.
Still, power has not come. I'm sorry for the inconvenience. I'll be happy if something can be discussed, and I hope the whole thing what I talked about was largely clear in
Yes,
the
sir.
discussion point. Yes.
Yes, sir. We could hear you, sir.
Thank you, madam. Thank you for the opportunity. Anything specific, I'll be happy to discuss.
Thank you very much, sir, for elaborately discussing on this topic, which everyone had a confusion. Just a couple of questions. Now, being in an academic institute, now we are giving, our candidate is publishing it. Then the faculty will be a co-author or a first author?
Now, to be very honest, the sequence of author has come when various regulatory agencies came into picture. Otherwise, always it is the contribution of each and every author is very important. And depending on that contribution, the sequence of authorship can be decided. When it is a student or a non-student or a guide, I will not go into that complication. I will say each and every person, if they satisfy the fourth criteria. If they satisfy fourth criteria, they enter into the second side of the table where they are eligible to be author. All those people who are going to be eligible to author as an author team has to decide how the sequence of first, second, third or corresponding author has to come. And it should be preferably done at the beginning of the planning of the study rather than burning the fingers at the end when everything is done. When it comes to a student and a guide, okay, now guide has a properly more of a supervisory role over the whole thing. My personal opinion says the student has to be a first author and guide has to be second author or third author, depending on how important people are involved in that research project. That's why each and every study, irrespective is a PG student or guide, I will look at the research study first, fulfill the criteria there, and being a student, being the main person who has probably conceptualized or came with the idea and data collection larger role, has to be the first author. Many times people say, as a guide, I have given the topic to that student, I should be the first author. Probably that's why we have to come to a point where let the postgraduate or a student come with the original idea of their own. We have to evolve in that research guideline rather than just giving topic from the guide side or from the higher side and later on come in the question of a guide should be first author. Because if the idea comes from the student from the beginning, naturally it has evolved from them. The person contributes to largely will deserve the first authorship, and the guide or the supervisory and other team members will have a other sequence of other things. And probably a person who knows everything about the research, who is going to finally communicate, will become the corresponding author. Only when these regulatory issues came, the first, second, third author and corresponding author probably became more important. Otherwise, earlier, before those guidelines came into picture, everybody was looking at the contribution of the author, which used to be classically published at the end of the article to say that everybody who has contributed what component of the article. Keeping in mind that full article is all authors' responsibility and aspect accountability comes into picture.
And one more question which I have is, we do a plagiarism check with our software. And when we submit it to the journal, again, they are sending it as it is more than 40% or 60%. And when we go into that, these are the common words, as you said, the common words are being shown, which is not analyzed again. So we are forced to rechange the statements, sentences and all that. So what is your advice on that?
Actually, madam, if you see many of the universities in India have a software like Original, though among, as far as my knowledge is concerned, Authenticate is one of the best. And finally, though we are checking at our level, which is as per the guideline of UGC and our university guideline of PGMC committee or Publication Guidance and Monitoring Committee or Publication Oversight kind of committee, which is looking up, then only university gives us for the publication chances. Once we get an approval from the university, we are submitting it to a journal. Each and every journal and editorial board has their own responsibility of checking the plagiarism. And when they have a higher kind of software, like say, for example, Authenticate, naturally probably will be able to pick up something which was not earlier picked up. Because we need to understand all these softwares are taking from the resources what they have in the public domain. If suppose Authenticate have more access to more online resources, naturally we'll be able to pick up more things compared to another software which have limited resources. Here, if those are the common things which are considered as similar, here editorial board has to put in their mind and really work on that to say that that is really plagiarized or only just mere similar. Many times they may not be fully qualified or equipped enough because the research group knows the best about the product rather than the editorial board. And that's why it may have come to us. And then we need to decide at what level of agreement we go with the editorial board. You write to them politely saying that these are not considered part of the largely similar and has to be excluded, and then revert, or just blindly follow them if you want a simple publication and get through the easy way out of it. Or third, we put our point and decide to withdraw the article from that very prominent journal, even if that prominent, and send it to somewhere else. It all depends how the group decides to publish it fast, though, because I may have my own ego to say that I don't want to agree, but we need to understand that the larger interest of the society, if that particular component of information is going to be really available. And that's why now, a couple of years back, and with COVID, lot of public domain servers are there where the pre-published copy of the article is available, which is probably not reviewed and not published, so that larger chunk of the people at clinical level or the society level can try look at those information which is yet not peer reviewed and published, so that it is available to public domain at a larger level. But we need to decide how much we accept with the editorial board, decide, agree, negotiate, and then finally either accept the condition or reject the condition and go to another journal.
Are there any other questions? So, and
ma'am.
one more thing which I wanted to ask you, mentioned in your presentation that the last author will be the senior most person. Is it applicable in the
There was
Indian
a classical trend internationally before this first, second, third author came into picture.
Now, is it the same trend in the Indian scenario, sir? Because
Indians, no, that's why, to be very honest, this first, second, third author will depend to a person who is looking at a regulatory body promotion.
okay.
Once a person has crossed the barrier of promotion, I don't think so anywhere first, second, third author will make a difference. Probably the two positions which will make most difference is the first author. That means I am really done a larger amount of that work, and the corresponding author who is probably taking the guarantee, accountability, and communicating. All other sequence probably more or less will remain almost equal. And that's why we say equal responsibility of all the authors when it comes. And really, in a particular forum, if I want to really give the importance of my work in a particular, the contribution of author to that particular research still plays an important role. So other than this promotion aspects where these guidelines may be involved by various regulatory bodies, I do not think so. Other than first and the corresponding author, any author will have a specific place. Though we say it is important, a fifth author is better than the sixth author, I don't think so. When it comes in alphabetical order, then probably a person whose name starts with Z will be always the last author in all kind of publication, but maybe the senior most and the most important person. So it all depends because of these issues. So first author, corresponding author is most important because they have largely contributed to the research work. Other things can be decided by the group. And even we need to understand when the project is decided, each paper will have a different component and objectives of that research, especially when the research is very big. It cannot be clubbed in one single publication, a particular aspect, say a genetic aspect. A person from a genetic may become the first author because that's a larger contribution coming, but other people will be second, third, and fourth. But probably in your own clinical specialty, if some publication largely talks about the clinical aspects, one of the clinician may become the first author and the person of the genetics nature may become fifth or seventh author. It also depends on the which objective and which kind of publication is there. And that's why always better to plan in advance so that this doesn't burn the fingers at the end of the whole study is over.
Okay. Thank you very much, sir, for enlightening so much. It's giving more clear picture to all of us. Are there any questions?
No, ma'am. So thank you very much because I
Thank you.
didn't have much knowledge about this. So I came to know about especially the voice messages which you played. That was a new concept. And thank you very much for accepting the invitation.
Thank you,
Thanks
sir,
a lot.
for
Thank you.
accepting
Thank
our
you.
invitation.
Thank you
sir.
all. Thank you all.
Thank you.
Okay.
Thank you,
Thank
Dr.
all the speakers and Indumati for this opportunity, including the IFS. Thank you so much.
Thank you, ma'am. Thank you.
Thank you. Yes, Dr. Suman, you wanted to speak something?
No, thank you very much. I'm from Shedman.
Yeah. Okay, can we leave now?